My name is Kate Langness, and I'm going to talk about a change that I would like to see in the healthcare system. The change I would like to improve in the healthcare system is more accountability when it comes to doing a thorough assessment. Assessment is the first step in the nursing process for a reason, because it is very important to ensure the best care for our patients. Doing a thorough assessment allows for us to catch small details that can be very important for us to learn how to best treat our patients. These small details can eventually be the difference between life and death. In the hospital, I've had multiple times where nurses have taught me how to do an assessment that was not thorough to save themselves time. I do understand that there are tips and tricks to becoming efficient when doing an assessment. However, multiple steps would be continuously skipped. This makes me worried that very important information about these patients was being missed. Even a step like checking pedal pulses and capillary refill is very important to help us learn more information about our patients. When the nurses were documenting these parts of the assessments that they were skipping, they would just document what the previous nurse had put. However, this makes me nervous because if multiple nurses are doing this in a row, then we are not getting accurate information on our patient for days at a time. This could be very detrimental. To implement change, I would use Lewin's change theory of unfreezing, movement, and refreezing. I chose this theory due to the 3 distinct phases that directly outline how we can implement change. This theory states that unfreezing happens when people are aware of the need to change. To do this, I would research and present how thorough assessments improve patient outcomes. People need to be aware of the issue in order to be willing to implement change. It also says that resistance should be expected due to the fact that people can cling to their old ways. In order to unfreeze, there needs to be communication between all the staff and everybody who is going to be affected by these changes. I would also need to listen to any suggestions or concerns that anybody had about these changes. Movement is the next phase that I would need to implement. The theory says this is where I should identify a plan and implement strategies. The plan I would implement is to give all the nurses a checklist of what is expected in a thorough assessment and just discuss all of the expectations with them. I would also give these to the nurse manager and the charge nurse so that they could go around and watch random assessments during each shift and provide the nurses feedback. I would be aware that change does not come easy and will take a lot of work, time, and commitment to get everybody on board. The last phase of this theory is refreezing. The theory says that this is when change should become a part of normal routine. We have to ensure that this stage is complete in order for old actions to not return. The nurses would need to be consistently doing thorough assessments and meeting these expectations. They would also need to make sure that they were accurately documenting their findings. The theory says that this can take 3 to 6 months to fully implement, so it's important that the nurses are consistently reminded and checked in on. After this stage, we could also take time to analyze if what we are doing is working and if there are any tweaks or changes that we need to make. Some barriers to these changes would be people wanting to stick to what they are used to. This is a common problem when trying to implement change in any situation. To fix this, I would have to keep communicating the reason that we need these changes and how to make it happen. Another barrier is that this change would be more time consuming. Having a thorough and longer assessment would take more time. However, this is how it should have always been. And so the charge nurses can also step up and just give the nurses a little extra help when they need it until everybody is in the flow with these new time changes. With my degree, I want to be a labor and delivery nurse, and I eventually want to go back to school to be a nurse practitioner. I want to use my degree to push for changes, any change that is needed at the time of my employment. To decide what changes are necessary, I would always use evidence-based practice. I hope one day to be in a place where I'm able to implement real change in my career. Overall, I believe a thorough and more accurate assessment is the foundation to good nursing practice. I hope to see more enforcement when it comes to the quality of these assessments and accurate documentation as well. Improvement won't come without there being people willing to make changes, and it's every nurse's responsibility to do so. Thank you.